Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide review courses, review books, review videos, and more to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to work with you as well if needed. But y'all know I always like to get into my disclaimer reminder before getting started that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see, I have created and designed based on the current guidelines on the ANCC as well as AAMP exam. Now, any of the videos, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient presents to the office today with complaints of a sore throat and fever. Upon examination, the nurse practitioner notes anterior cervical lymphadenopathy. Based on this presentation, what is the best diagnosis? Is it A, strep throat, B, mononucleosis, C, COVID, or D, influenza? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first, so it allows you to slow down and truly answer what's being asked. So here, the stem of the question states, based on this presentation, what is the best diagnosis? So, I'll tell you, if we are coming up with a diagnosis, you got to run it back and see what the assessment findings are showing. So this patient came in complaining about sore throat and fever, right? Those are your subjective findings. And then on exam, the nurse practitioner also notes anterior cervical lymphadenopathy. And this is one of those key identifiers, and I say make sure you know those. Because when I say this, you say that, right? So if I say anterior cervical lymphadenopathy, I want you to think strep throat. Because remember, Brittany's brilliance, I tell you, with strep throat, there is anterior cervical lymphadenopathy, but with mono, there's posterior lymphadenopathy. So here, our differential diagnosis, the best answer will be A, strep throat. All right, question number two. The nurse practitioner has strep throat as a differential diagnosis. What test should be completed to confirm? Is it A, a rapid strep test, B, influenza, C, monospot, or D, a chest x ray? Take a moment and tell me what you got in the comments. All right, so stem of the question states, what test should be completed to confirm? So what are we confirming? We're trying to confirm the differential diagnosis of strep throat. So easily, you guys, you should know, A, we do a rapid strep test to confirm those diagnoses, right? And then lastly, the strep throat diagnosis has been confirmed. She denies any allergies. So what is the first line treatment for strep throat? Is it A, doxycycline, B, amoxicillin, C, augmentin, or D, azithromycin? Tell me what you got in the comments, you guys. All right, so stem of the question states, what is the first line treatment for strep throat? Is it A, doxycycline? No. Is it B, amoxicillin? Yes. Penicillins, most commonly amoxicillin, is that first line treatment if there's no allergies for strep throat. If they do have an allergy, you can go azithromycin, okay? But amoxicillin is that first line therapy. All right, you guys, I hope you found this helpful. This was a short and sweet 3 questions today, but I wanted to kind of walk you through the strep throat process, presentation, assessment, diagnosis, confirming the diagnosis, and how we're treating, okay? But as always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all beat me back here. If you need any of the resources that I offer, my review book, the ebook, as well as paperback option are both linked in the bio of this channel. If you're looking for something that you can do independently, my self-paced review course designed for family and adult GRO reviewers preparing for the ANCC as well as AAMP exam is also linked in the bio of this channel. And I do have a 5-week group review that I do periodically throughout the year, but we're currently in one that we just started. So just be on the lookout for the next one. And then lastly, I do one-on-one sessions, 3 different tier options. If you're looking for something to help you with a weakness, that's the session you can do. If you're needing a session just to assess your exam readiness, that's an option. Or the custom package is utilized typically for people who have been unsuccessful previously and are looking to see where they're, have gone wrong and to structure their studies so that they can be successful. And I always say with those one-on-one sessions, be sure to reach out to us, either calling or emailing, so that we can gauge what you truly need since it's so customized. But if you need any of our services, just give us a call at 803-400-6864. You can also text that number or shoot us an email at the nursing studio, the number one at gmail.com. All right, happy studying. Bye, y'all.